I'd say that it is something that you really do need to look at, because it's really changed the way in which my life has gone. As any OB would know, we all kind of aspire to ending doing OB and doing just gynecology, but frequently that's difficult to do from a financial point of view. This allows you to kind of move towards that in a very controlled pattern. I would say that if you are a single physician who has some trouble with call coverage, you want to make sure that you've got call coverage when you're doing the procedure, but that's no different than if you were doing a surgical procedure in the office. Once you start, you want to be able to be finished. But you will very quickly find that it's either a great supplement to what's going on. You don't have to bill anybody. You get paid cash. It very quickly allows you to make the decision on whether you're going to do certain things like continue to practice OB. In my case, it allowed me to stop practicing OB, and it allowed me to stop taking Medicaid. So now I do, for my gynecology practice, I take nothing but private insurance. I still take Medicare on occasion. And I have reasonable nights. I have, you know, because I can't do OB, when I stopped doing OB, my insurance went from $55,000 a year to $20,000 a year. So that made a big difference. And I find that being able to do this, I have a regular day, I get home in the evening, I'm not going out at night, and my kids seem to be very happy that they actually see me on occasion. First and foremost is that we know them very well and they're comfortable with us. It's difficult to tell a patient that a particular procedure is technically very straightforward because they don't really have a reference point on which to go through. But the fact that we can go in and do all that we do internally, and we can do stuff laparoscopically, minimally invasive procedures, just makes this a very dead easy thing to learn and to be particularly good at. They know us, they trust us, and we're doing this as an adjunct to other events in our office. We have a nice facility, but we don't have some of the things that you see in a plastic surgeon's office, and so our overhead doesn't need to be anywhere near that high. And with us, what happens is they know us, they trust us, they can get exactly the same result, and most of the time they won't end up paying anywhere near what they would pay if they went to a plastic surgery type practice. It's very simple to do. If you have a power table, it works really well. We use the mid-mark one, but any kind of power table that allows you to manipulate the patient is a great thing to start with. You need a side table to put your sterile equipment out. What we do is we just buy a back table sterile pack from one of the medical supply houses, and it's got drapes, prep, everything else. We just spread that over our counter. We then go ahead and prep the patient. In my case, I've bought cesarean section drapes because you can get a lot of fluid from this, and some of the C-section drapes with the big opening and the adhesive around the outside really allows you to keep the moisture in the right spot, stops the patient getting wet and cold. You end up having the normal things, knife blade handle, something that you can suture with at the end. And then as far as the actual equipment that I use, you need a pump in order to pump in the tumescent fluid. There's a number of different suppliers that make those. You need a suction that is set to allow you to suck the fat back out again. We have our PAL system, and it was very reasonably priced when you compare it to a lot of the other things that we needed to get. My average billing for an abdominal lipo procedure would be around $3,500. A large number of people want to have a tummy tuck done at the same time, and that generally brings it up to the $4,500 range. Really, you can do it in any room at all. I've done it in small exam rooms. I've done it in a bigger procedure room. This happens to be my procedure room, but when we moved in here, we made this bigger on purpose because we wanted the extra room that was there. But by no means do you need anything this large. You need, the footprint that you need is enough that you can walk around the outside of your table that the patient's on. You need a space to put to create a sterile field. And you're going to likely have an assistant with you. So you just need a little bit of room to move around the table. But once the patients are on the table, they're not going anywhere. And at the end of it, extra space really is a luxury more for yourself than it is anything else. I would tell people that if they had a procedure room already, then they're 99% of the way there. If they don't have a procedure room, they can just as easily do it in most exam rooms. It just means they'll have to position things and arrange things to allow them to get both sides of the table. Doing liposuction on women's abdomens is a very straightforward thing to do in the office. You've got the vast majority of the equipment here already. More importantly, you've already got the clients. Women are an ideal group because their fat's deposited between the fascia and the skin, not deeper down like men. And they're also quite aware of how they appear. They've got a level of trust in you that will make them listen to what you have. You really don't have much of an upfront investment with this at all.